Hi, I'm Dr. Janet Pope. I'm with Room Now. I have a Twitter handle of @JanetBurdope. I'm reporting with Room Now at the ACR 2020, our Convergence virtual meeting. I'd like to talk about something that's really a buzz at the meeting, looking at hydroxychloroquine and whether it prolongs a QT interval or not. So this was a plenary session, abstract 431. It's from Elizabeth Park et al., and that's a large group out of Columbia University. And the question here was looking at over 600 patients with rheumatoid arthritis and SLE and asking the question, if patients are on antimalarials, is there prolongation of the QTC interval? It's important for two reasons. One is the annoying faxes we get from pharmacists that say there could be drug-drug interactions and hydroxychloroquine in the doses we use. Sometimes an alert will come up. So that's the first reason. The second reason is at very high doses, sometimes with azithromycin or clarithromycin, and patients who were trialed with COVID, now negative results in those COVID studies on hydroxychloroquine, but there was prolongation of the QT interval. So this was an excellent study to answer that. They did propensity scoring. They had RA and patients and lupus patients. In general, some patients had imbalances on some comorbidities, such as heart disease, which obviously an imbalance could be important. There were imbalances in the amount using corticosteroids and a few other differences. With either adjusted or unadjusted propensity scoring of these patients, it was found very reassuring that hydroxychloroquine and chloroquine, the vast majority on hydroxychloroquine, did not prolong the QTC interval. And in fact, the heart disease patients were excluded as they had active heart disease at the time, but patients with known past coronary artery disease also did not have prolongation of the QTC interval. The next part of the study was to look, are there drug-drug interactions where this could be occurring on the ECGs if there were other drugs that could prolong QTC interval as well? And bingo, no other changes there as well. Take-home message is, I do believe that this is helping to convince me still that antimalarial drugs are safe for our patients with RA and lupus and the doses we use, and that we don't have to worry about the QTC interval in our patients, and we don't have to worry about drug-drug interactions. I appreciate this study. I think it's clinically relevant for us when we practice every day. Thanks, enjoy the meeting, and we'll see you at Room Now.